go ahead.
If she wants, I don't know if it's okay. I can.
Yeah, you can go ahead. She can read
Okay.
the next one.
The Canadian Task Force on Preventive Health Care recommends measuring height and weight and then calculate body mass index BMI at appropriate uh, primary care visits. Strong recommendation, very low quality evidence. Recommendation apply to most adults equal or more than 18 years of age. Recommendation do not apply to pregnant women or people with health conditions where weight loss is inappropriate. Recommendation do not apply to people with BMI equal or more than 40 who will benefit from specialized bariatric programs. What is your patient's BMI? So calculate BMI by measuring height and weight and using BMI chart. So BMI less than 18.5 means underweight. This category is outside the scope of this guideline. I mean, it's too low.
Mm-hmm.
So 18.5 uh, BMI to less than or equal to 24.9 normal weight. Do not offer normal, sorry, do not offer formal structured behavior interventions aimed at preventing weight gain in adults. And the next one is 25 less than or equal BMI to less than or equal 29.9 overweight. So the first one is normal, 18.5 to 24.9. And now we are talking about the overweight, which is 25 to 29.9. Have a discussion with your patients and offer provide referral to structure behavior intervention aimed at weight loss. And the third one is the 30 equal or less than 30 to equal less than 39.9. It is obese. Have a discussion with your patients and offer or provide referral to structured behavior intervention aimed at weight loss. I mean, the overweight and obese, you have to follow the same protocol.
Mm-hmm.
And the 18.5 to 24.9 is normal, and under 18 is 2. I mean, underweight.
Yeah.
So, okay. What are appropriate primary care visits? Routine visits, visits for medication renewal, and I have to read this too.
Yeah, you can quickly
Okay.
read it.
Okay. Routine visit for medication renewal and other visits where the primary care practitioner deem it appropriate. So, what are structured behavior interventions? Programs focused on behavior modification that involves several sessions over a period of weeks or 2 months. And then recommended programs should focus on. So, we should focus on modifying diet, increase exercise, making lifestyle changes, any comorbidities of these. So, we have to focus on these four things. So, of course, the lifestyle modification nowadays is very mandatory.
Yeah.
So, the programs for obesity management may also include counseling, education or support, environmental changes, use for smaller plate. Can I instruct my patients to calculate their own BMI or can I estimate? We recommend that physicians or another member of the healthcare team measure weight and height to calculate the BMI, patient's BMI. Adjust, adults tend to overestimate their own height and underestimate their own weight.
Mm-hmm.
Yeah, this is true. Visual estimation by clinicians is often inaccurate and will not detect the relatively small gain occurring among most adults.
Mm-hmm. The physicians should do the. So this is all the
Yes.
my chart, and so this is basically the obesity guidelines for adults, and then they have obesity guidelines for kids also. So we will quickly go through this if you want to continue.
Child obesity prevention and management recommendation table. Prevention recommendation apply to healthy weight children or youth 0 to 17 years of age. Maintain healthy BMI trajectory according to WHO growth chart for Canada. They do not apply to children and young with eating disorders or who are underweight and overweight or obese. So these are the children 0 to 17 years and the conditions apply.
So maybe you can do the chart.
Okay.
Yeah, we'll see the chart.
Sorry, I was reading. I think my internet is messed up. I can't read.
Sana, you
Sorry.
can continue. Okay.
No
Next.
worries.
I don't
So
know
she,
my net because it might get offsets at any time.
okay, so you should maybe you can continue.
Okay. So recommendation, growth monitoring. So there is two, prevention and management. Applies to all children and youth age 0 to 17. So I have already be recommend growth monitoring at all appropriate primary care visit using the WHO guide chart for Canada. Strong recommendation.
So growth
Then
monitoring is done for all the children 0 to
0 to
17.
17, yeah.
Okay.
They are under the care of pediatrician, 0 to 17 years.
Yeah.
So the structured behavior applies to children and youth of healthy weight age 0 to 17. We recommend that primary care practitioners not routinely offer structured behavior intervention SBI aimed at preventing overweight and obesity in healthy children. So applies to overweight obese. So should I continue like this? Yeah.
Yeah.
The applies to overweight or obese children and youth age 2 to 17. We recommend that primary care practitioner offer or refer children and youth to structured behavior interventions aimed at healthy weight management. Weak recommendation. And the pharmacological, not recommended. And the second one is applies to children and youth age 2 to 11 years. We recommended that primary care practitioner not offer uh, all estate aimed at healthy weight management. And then second one is applied to children youth age 12 to 17. The first one is 2 to 11, then 12 to 17. We recommend that primary care practitioner not offer all estate aimed at healthy weight management. So these two drugs are not recommended.
This means that we will give drugs to the 2 to 11 years
No,
or
the early stat is basically
Yeah,
the weight it's giving in obesity in adult.
Weight reduction medication.
Yeah, but they are saying
they
even
are
the
not
child is
recommended
obese 2 to
pharmacological
17,
therapies.
it should not be recommended.
any other medication we can give for the obesity for the children who are 12 to 17
No,
and 2
no,
to
not
11.
No,
usually
they are
not.
not
You have
recommended.
to cover lifestyle
No, no,
modification
not
until and
recommended.
until
Not
it's more than
recommended.
40.
You are messing up with their metabolism.
Mm-hmm.
Okay, okay, okay. Can you move up the slide? What's written structural behavior intervention? Okay, fine. Thank you.
So surgical, again, not recommendation. Applies to overweight or obese children and youth age 2 to 17. We recommend that primary care practitioner not routinely, main thing is routinely, refer for surgical intervention until and unless there is a specific case or some other indications are present.
And in all
So
the
not
obese
routinely
children.
done. No pharmacological or no surgical.
Mm-hmm. So
I have a
only
question that if like we have a patient like Cushing syndrome or like this neurological symptom in which the children are mostly obese, would we recommend or still I think we will not
No, no.
recommend?
The Cushing syndrome is just because of the hormonal imbalance. To
Yeah,
treatment with the
but
hormonal imbalance, it's automatically correct
Mhm.
your. Otherwise, the simultaneously you can recommend for the lifestyle modification.
because these recommendations they have written they do not apply to children and youth with eating disorder,
youth with eating
underweight,
disorder.
overweight
Oh,
or obese.
Yeah, any other
okay. In
conditions
any
like.
case, just we don't give medications to the kids.
Yeah, and in this structural behavior intervention that they are saying to offer is like this. Here they have written.
But in certain conditions, like let's say for like genetic conditions or hereditary condition like hypercholesterolemia or triglyceridemia, if there is a family history, that is another case. And
Yeah,
obesity is more than
Hmm.
I mean 40.
yeah,
So there is another recommendation. They have to visit to the pediatrician or another
yeah.
consultation. Yeah.
So now if you want, we can continue from the Toronto notes.
Okay, that's good.
So those are basically the recommendations that they have like written here, the summary. But yeah, who is reading?
You want me to read or any other volunteer available?
I think you can finish the obesity if you want.
Okay. So obesity definition: prevalent, complex, progressive, and relapsing chronic disease that is characterized by abnormal excessive body fat, adiposity. So what is that? Impairs health, increased risk. I can see I have to make it bigger
You can
actually. Yeah.
start from the task force. I think it's like a lot of reading, so maybe just start from task force recommendations.
Uh, oh, this one, 2015 Canadian Task Force,
Yeah, yeah.
or okay, on preventive healthcare recommendation. For apparently healthy adults equal or more than 18 years, it is recommended to measure height, weight, and calculate BMI at appropriate primary care visits. So BMI, how to calculate the BMI is weight in kg and divided by height meter square is equal to height in pound, or other way is first one is in kg and meter square, the second one is weight in pounds and height in inches square, and multiply by 703. This is the formula which applies. Note this recommendation does not apply to people with eating disorder, again, who are pregnant. So it is not applicable on these two conditions: eating disorder or who are pregnant. For those with increased BMI 25 to 34.9, uh, WC should be, well, what is WC?
Weight circumference.
Okay, width. Oh, okay, okay. Should be measured regularly to identify patients with increased visceral adiposity and related health risk. So there's a classification table for classification of weight by body BMI and associated disease risk in adults. So there's a chart. There's a on the left hand side underweight, normal, overweight, and obesity class 1, 2, and 3. And the second row is BMI in kilogram, and then the third one is risk of developing health problem. So the underweight is again less than 18.5, and the health problem again increase. You are not supposed to be underweight too. So normal is 18.5 to 24.9. So this is least risk group. The overweight is 25 to 29.9. So again, the risks start increasing. So now this is the overweight. Now we are starting the obesity class 1, 2, and 3. So the obesity class 1, 30 to 34.49. Again, the health problems increase. Their risks are very high. And in class 2, 35 to 39.9, very high. And obesity class 3, extreme obesity, is equal or more than 40. It is the health risk again extremely high. So the management is Canadian Adult Obesity Clinical Practice Guideline recognize that people with obesity experience weight bias and stigma, which contributes to increase complications and mortality independent of weight or BMI. Step one: ask, recognize obesity as a chronic disease and obtain patients permission to discuss and help treat this disease in an unbiased manner. Step two: assess. Assess the patients using appropriate measure, height, weight, WC, and BMI calculation, and identify root causes, the biological factors, individual life experiences, psychological factors, complications, and barrier to treatment. Now, the step three is advice. Discuss treatment options and work with the patient to create individualized care plans that address root causes of obesity and support behavior changes. Nutrition. All individual can benefit from adopting a healthy, well-balanced diet. Weight loss requires long-term reduction in calorie intake, encouraged by a personalized eating pattern that meets the patient's value, preferences, and nutritional needs. Medical nutrition therapy. should not be used in isolation, may promote compensatory mechanism that promote positive caloric intake by increasing hunger, but instead should be used in combination with other intervention therapy like psychological, pharmacological, and surgical. The physical activity, first one is nutrition. Now, physical activity, consider the aerobic physical activity 30 to 60 minutes for moderate to vigorous intensity, moderate days per week. For adults who wish to achieve small amounts of body weight and fat loss, reduce abdominal visceral fat, maintain weight loss, and or increase cardiorespiratory fitness. Resistance training may promote weight maintenance, increase muscle mass, fat-free mass, and morbidity in adults with overweight, obesity. Regular physical activity and improve metabolic risk factors and improve health related quality of life. Now, the last one is psychological and behavioral interventions. Competent psychological intervention, behavior modification, cognitive therapy, and values based strategies to alter diet activity should be incorporated into care plans for weight loss.
So this sidebar I think is important, the pharmacotherapy for obesity. So if you can read
Mhm.
this.
Can you move on? Okay, yeah. Uh, pharmac- Pharmacotherapy for obesity. There are currently three prescription medication available in Canada that are approved for use in adult patients with BMI equal or more than 30 or BMI more than or equal 27 kilogram meters square and more than or equal weight related conditions like hypertension, type 2 diabetes, or dyslipidemia. So these medications should be used alongside a reduced caloric diet and increased physical activity. So not only the taking the pharmacological, you have to pay attention of the reduced caloric intake and physical activity. So contrast this naltrexone and bupropion controls hunger and craving. I know the bupropion, but naltrexone is also used for the pharmacological therapy. Uh,
Yeah, I didn't know
Saxenda,
it.
Saxenda, yeah, decrease appetite and therefore food intake. Xenical, yeah, only said, yeah, this is okay. Reduce dietary fat absorption by 30% through inhibition of pancreatic and gastric bypasses.
And
So
this is
associated, yeah, this is important. Association with low BMI, osteoporosis, eating disorder, undernutrition, and pregnancy complications. The osteoporosis is very, very common. Low BMI.
mhm.
So that's it. Or
You can finish it.
this one, effects of popular.
Or you can just review the chart because this is all the pharmacotherapy that we have already studied at
Yeah.
the chart.
Mhm.
So it is like the, so you want to review the chart quickly?
Just wait. So overweight, obese, adult, measure BMI, measure waist. This is the WC, waist circumference. If BMI is more than 25 and equal or less than 35. If BMI more than 25 or waist circumference is above cutoff point, then what the next step? Conduct clinical and laboratory investigation to assess comorbidities. So if BMI is more than 25 or waist circumference above the cut point, so what will you do? The conduct the clinical and laboratory investigation to assess the comorbidities: blood pressure, heart rate, fasting glucose, lipid profile, total cholesterol, triglyceride, LDL, and HDL cholesterol, and ratio of total cholesterol to HDL cholesterol. Then assess and screen for depression, eating, and mood disorders. We have to also exclude the psychological factors. Treat comorbidities and other health risks if present. Assess readiness to change behavior and barrier to weight loss. This is also very important.
Mhm.
So, important message: a modest weight loss, 5 to 10% of body weight, is beneficial. Weight maintenance and prevention of weight gain should be considered as long thumb gone. Actually, it is very moderate. The patient usually start, okay, we will start losing the weight, but it is very, very difficult to continue. At the maintenance phase is very difficult.
Mm-hmm.
So device goals and lifestyle modification program for weight loss and reduction of risk factors. Weight loss goal 5 to 10% of body weight or zero point 0.5 to 1 kg, 1 to 2 pound per week for 6 months. The next health team to advise lifestyle modification and program. So this is the last one. It will continue like this. The lifestyle modification program nutrition reduce energy intake by 500 to 1000 kilocalories per day. So you have to reduce in your diet. So 500 to 1000 kilocalories. Physical activity initially 30 minutes for moderate intensity, 3 to 5 times per week. Eventually more than 60 minutes on most of the days. At advanced exercise training, medical evaluation is advised before starting activity program. Cognitive behavioral therapy. This is very important. So
And
satisfy.
also the exercise, how much exercise is needed,
Yes,
also important to remember.
yeah. Initially, we start 30 and then gradually increase.
Mm-hmm.
So this is the satisfactory progress or goal achieved or not. Yes. Then regular monitoring. This is very important. Assist with weight maintenance. This is the maintenance phase is very. Enforce healthy eating and physical activity advice. So next, weight maintenance and prevention of weight gain. Nutrition therapy, physical activity, cognitive behavioral therapy address other risk factors, periodic monitoring of weight, BMI, and waist circumference at appropriate primary care visit. If no, then what will you do? Pharmacotherapy. BMI is if the BMI is more than or equal 27 and risk factors are present, more than 27 risk factors are present or only more than 30, then what will you do? Adjunct to lifestyle modification, consider if patient has not lost zero point 0.5 to 1 kg or 1 to 2 per pound per week by 3 to 6 months after lifestyle changes. So you have to add the drugs. If again no, the bariatric surgery. If BMI is more than 35 and risk factors, or BMI is 40, so 35 with risk factor or equal or more than 40. Consider if other weight loss attempts have failed, require lifestyle medical monitoring.